I see a patient with a cervical cancer, I often ask them one question. When was the last time that you saw a doctor and had a screening, a cervical screening? And like in 99% of cases, they told me that it had been 5 years or it had been 10 years. And then I asked them another question. Why haven't you seen a doctor for so long? And then, like again, almost all of them tell me that I haven't seen a doctor for 5 or 10 or 15 years because I wasn't sexually active the whole time. Or the other answer that I get for that question is, that's because I'm in a post-menopause. Actually, that's a huge mistake. Even if you're not sexually active at the present moment, or if you haven't been sexually active for the last 15 years, but you had sex like even once in a lifetime, you still be at risk of sexually transmitted infection or HPV, and sometimes once is more than enough. And you still see a doctor even if you're not actually active, because many of reproductive health diseases doesn't depend on your sexual activities. And the second answer is also not true. You still need to see a doctor even if you are in a menopause. Okay, that was like a first lesson in this video, and now let's move to pap smear. Cervical cancer remains a significant threat to female health, despite its preventability. By skipping or delaying pap smear, a cervical screening, females actually put themselves at risk of life-threatening disease. I think that this trend should be changed. So, that the main purpose of this channel is to help females to know their body better and to empower females to take control of their health. And I ask you to help me with this goal of mine. It's so easy to do. You need just to click this share button. It will take you like 3 seconds or maybe even less, but it literally can save someone's life. Okay, what is pap smear? Pap smear, or sometimes it's called cervical cytology, is a procedure when doctor collecting cells from your cervix. And this procedure helps us to find cervical cancer in the very early stages or find some precancerous cells. And precancerous means that these cells might become cancer in the future. To perform cytology, doctors need a tool which many of you might be familiar with, and this tool is called speculum. Doctor will insert speculum in your vagina, and the speculum will help us to see a cervix because it will widen the vagina walls. The speculum might be in different size, it might be from the different material. That's just an example. Well, after widen your vaginal walls, doctor will see your uterus. Well, it will look something like this. It really looks like a cervix, After this, we will fix this speculum open, and now we need another tool. Now we need a brush, and many types of brushes can be used. And to collect cells from your cervix, we need to use a brush. Sometimes we can use a brush like this, or we might use a brush like this. And if you're using this type of brush, we need actually 2 of them. Now let's pretend that this is a cervix. One brush is for collecting cells from the surface of your cervix, and the other one is needed to collect cells from the inside of the cervix. After material is collected, we need to apply this material on the glass. One glass is for material from one brush, from the cervical canal and from the surface of the cervix. But the best way for cytological examination is a liquid-based cytology. Liquid-based cytology is a method of preparing samples for cytology. In this method, we collect in cells with one brush and then we suspend samples into the liquid medium. And this is the better way because if you're using a tool like this, for example, some material might stay on this brush after we put it on the glass. And when we're using liquid-based, all the material goes into this liquid medium. Many females are scared that pap smear might hurt them, but actually pap smear isn't like painful procedure, but of course it might be a little bit discomfortable. And also you might see a little spotting after this procedure, but it should stop very soon and it shouldn't be a flow. I have advice for you how to make this procedure less uncomfortable. But this advice is not only for pap smear, it will also make the whole gynecological examination less discomfortable for you. And the secret is, all you need to do is just try to relax as much as possible. When you're scared or stressed about examination, you might constrict your pelvic floor muscles. And this really makes it difficult for doctor to perform examination, and it's even hard to open the speculum, and because of this you might feel a little pain. And while this procedure, try to focus on your breathing, or maybe you can count to 10 or any other number, and you will see the difference. The procedure will really be less painful for you and less discomfortable. It's recommended to start cervical screening at the age 21 or 3 years after your first sexual intercourse. Between 21 and 29 years old, it's recommended to perform screening every 3 years in case that you have your previous pap test negative. And after 30 years old, co-testing is recommended. Co-testing means that you should undergo not only pap test, but also HPV test. And if you have it all negative, the next time you should do co-testing in 5 years. And you can stop cervical screening at the age 65 years old in case that your previous screenings was up to date and it all was negative. Cervical screening might be recommended to you more often in case if you had cervical cancer, or in case if you had like precancerous cells, or maybe if you have HIV or immunodeficiency. And you know, these recommendations is from the guidelines which we have in my country, but it might be different in your country, so please ask your doctor about it. And for example, I saw guidelines of American Cancer Society, and they recommend to start cervical screening at the age 25. So discuss this with your doctor. Again, I will ask you to share this video with your friends or family members, because we should remember that cervical screening might save someone's life. Thank you for watching this video. I can't wait to see you soon in my next one. Bye!